when you and I were growing up, that was a mercury filling. And then we either break the filling or we break a portion of the tooth, and then we have a crown, only to find out a year or two later that we need a root canal, only to find out a few years later that the tooth needs to be removed. And then we have an option of an implant. And it goes on and on. And I think what we need to be doing in dentistry is be doing thorough dentistry, for sure, but doing it as conservatively as possible. Quite frankly, in this country, I think we're doing far too many crowns on teeth that could be restored beautifully with bonded restorations, which save more of the tooth and don't predispose the tooth to nerve damage further down the road.
That's astute. I don't think people also know that they can have their root canals removed.
They can have their root canals removed, and the patients are referred to me from integrative physicians around the world, encouraging the patients to have those root canal teeth removed because of the toxicities.
My dear friend's child had 3 root canals, and I was so horrified and so upset. He's a young boy with asthma. I thought, my God, that's young. It's young. He was at a private school, and he went to a dentist there, and I just wonder how many kids are getting root canals now.
Well, a lot of kids get root canals because many of the root canals are performed on their primary teeth, on their baby teeth. It's a very, very common procedure. The advantage to that is that the child gets to keep the tooth, and it helps hold the space open for the permanent teeth to come in. The disadvantage is that there will be bacteria associated with that tooth until the day it falls out, and that can be a challenge to the patient's immune system. So it's a very, very difficult thing to measure. How could we, for example, ever say that the asthma or any other health condition of that child is caused by his teeth? But there are certainly many reports of people who have had root canals removed, whether they're adults or children, only to see their health issues clear up.
Okay, and the last thing I want to ask you about is braces. My older sister got braces first, then I did. And our teeth definitely moved. Now, my front tooth reabsorbed. I want you to explain to the audience what that is. And I don't remember ever being hit in the face, even as a tournament tennis player for 13 years. The only other way that is known is that the braces can sometimes move the teeth too quickly, at least during that time. Is that accurate information?
It's accurate information. Teeth can be moved too aggressively, and some teeth seem to be more apt to resorb like yours. It's actually a fairly rare occurrence. Resorption of a tooth is where the root of the tooth typically begins to dissolve away, even though the patient does not have decay. It's very well noted in the literature. Resorption it can happen from within inside the tooth, which is called internal resorption, or it can happen on the outside from outside in, which is called external resorption. Either way, it typically means that the tooth is doomed. When it happens, it's typically not a painful issue, but the tooth loses its foundation. It's kind of like having termites in your foundation of your home, and before you know it, you're left without a foundation.
Sounds disgusting.
Well,
I lost my tooth from those termites. And here's the other thing. This was a shocker because not only do I floss every day, but I also clean my tongue twice a day and drink tons of water. So it was shocking that it wasn't an issue of hygiene, but that this can happen from moving the teeth too aggressively.
We see it most often from trauma, like blunt trauma, like hitting your mouth on the steering wheel during a wreck. And then any time from months to years later, the tooth will begin to resorb. But we do see it also as a result of orthodontics. Fortunately, it's a rare occurrence, but I'm so sorry that you were one of those people who got to experience it.
I consider myself blessed and lucky now that I've met you and I know about revisionist dentistry. You're helping so many people, and I really want to thank you for being on the show, and I think we've done a comprehensive segment here. Ladies and gentlemen, we have been listening to, learning from, and talking with Dr. Stuart Nunnally of Nunnally and Freeman. You can reach him and the practice by going to healthysmilesforlife.com. We thank you, and we hope that you will join us again in the future as you have more to share with the public. Thank you so much for being our guest, Dr. Nunnally.
Thank you, Kim. What a privilege to be with you. God bless you.